The University of Kentucky began its first round of COVID-19 vaccinations on Tuesday, and since then, hundreds of medical professionals have received it.
LEX 18's Eleanor Buckley spoke to Dr. Charles Eckerline, who was one of the first people at UK to get the vaccine. He has more than 40 years of experience in emergency medicine, and he also happens to be Eleanor's uncle.
On Tuesday, Dr. Charles Eckerline received his first part of the COVID-19 vaccine.
I was one of the first people, in fact, the first doctor to get it.
In a few weeks, he will receive another booster dose, and until then, he won't have immunity. He will continue to take the appropriate steps to protect himself and his patients, but says this is a pivotal moment in Kentucky's fight against the virus.
But hopefully, as we get more and more people immunized, particularly people that are high risk and people that have a lot of comorbidities, we'll begin to open things up a bit and hopefully get back to normal by the spring.
And as it becomes available, he encourages everyone to get it.
For anyone that is worried, I would just reassure them that the risk of the disease is much, much, much greater than the vaccine, and they should take it unless they have some specific contraindication. So I would really encourage people to take it. I've had no problems whatsoever.
My uncle was one of the first to get the vaccine because of his high exposure as an ER doctor. He's treated hundreds of COVID-positive patients and has been practicing emergency medicine since 1979, meaning after 42 years, he didn't stop to take a break, even when the pandemic hit.
I felt that I was in good health. I was not unaware of the risks because age is a factor, but we needed the people. Some of my younger colleagues offered to work some shifts for me early on, but I didn't really feel it was fair to ask them to do it.
And while he may be humble, he has always put his patients and his family first. He's a grandfather of 4, and we are also thankful for the vaccine so he can continue to save lives.
I think we're frontline workers, just like, and I think we're essential, and it's important that we stay there and take care of people. We've had a lot of COVID patients in the hospital, and we've had the need for as many people to help out as we can.
In Lexington, Eleanor Buckley, LEX 18 News.